Magandang umaga po muli sa ating mga participants. Nakakapasok lang po sa ating Zoom call, especially from regional offices po ng DILG and DOH, mga kaliga sa barangay po natin from the Visayas Cluster. Good morning po. Ako po si Lindsay from the Communications Management Unit, and I will be moderating today's town hall para sa Tutok A2 sa ating mga lolo at lola. To officially open our town hall po for the Visayas Cluster, here is Undersecretary Rosette Vergere, our DOH official spokesperson, for her opening message. Good morning po, Yusek.
Thank you very much, Lindsay. Magandang umaga po sa inyong lahat. Nais po naming pasalamatan ang lahat ng ating mga kasama sa okasyong ito, lalong-lalo na po yung mga kasangga at kaisa natin sa paghahatid ng protection sa ating mga senior citizens. Lagpas 4 na buwan na po nung nakalipas mula nung dumating sa bansa natin ang ating mga bakuna laban sa COVID-19. Ang pagdating po ng mga bakunang ito ay nagbigay ng bagong pag-asa at para sa kaligtasan at sama-samang pagbangon nating lahat. Ngunit dahil din po sa COVID-19, ito po ay isang pandaigdigang hamon, alam po natin lahat, hindi po natin maiiwasan ng iba't ibang pagsubok gaya ng supply ng bakuna. Nariyan na rin po na nakita natin ang kakulangan ng kumpiyansa ng publiko sa kaligtasan at sa pagiging epektibo ng ating mga bakuna. Lalong-lalo na noong tayo ay nagsisimula pa lamang sa ating programa sa pagbabakuna. Bilang tugon sa limitadong supply ng bakuna, ay ipinatupad po natin ang ating vaccine prioritization na binuo naman ng ating mga kasama sa World Health Organization at ang ating mga dalubhasa o eksperto. At upang patuloy po nating mahikayat ang publiko sa pagbabakuna, nairiyan din po ang ating kampanya upang labanan ng anumang maling impormasyon na nagdudulot ng agam-agam sa ating mga mamamayan at lubos na mapataas po natin ang vaccine confidence, lalong-lalo na po sa ating mga high-risk population groups. Ito rin po ang ating layunin ng ating Tutok A2 Information Caravan bilang pagkilala sa ating mga lolo at lola na kabilang sa ating mga high-risk population groups at upang hikayatin silang piliin ang dagdag na proteksyon na hatid ng ating mga bakuna. Naiintindihan po natin ang iba't ibang pananaw ng mga sektor ng ating lipunan. Maaari kasi natin na ang ating mga senior citizens sa adhikaing ligtas na malampasan ng pandemya, ngunit maaari din may iba na ang mga katanungan at agam-agam na umiikot sa kanilang mga isipan. Atin pong inorganize ang information caravan na ito kasama po ng ating mga eksperto at iba pang mga partners upang pag-usapan po natin ang mensahe ng kaligtasan at proteksyon na dala ng mga bakunang ito. Ito po ay makakatulong sa pagpapataas ng ating vaccine coverage, especially among our senior citizens. Critical din po na pag-usapan natin ngayong araw, lalo na't binabantayan po natin ngayon ang Delta variant. Ito po ay isang klase ng variant ng COVID-19 dito sa ating bansa. Marami na pong bansa sa buong mundo ang nakaranas ng pagtaas ng kanilang mga kaso dahil sa Delta variant, kaya't kailangan po nating pag-igtingin at pabilisin palalo ang paghahatid ng proteksyon sa ating populasyon, lalong-lalo na po sa ating mga lolo at lola. Naway maging makabuluhan ang ating diskusyon dito sa ating Infocaravan nang sa gayon ay mabigyan po natin ng linaw ang mga katanungan at saka agam-agam ng ating mga lolo at lola tungkol sa pagbabakuna. Muli, maraming salamat po sa inyong lahat sa pakikilahok at kinakagalak po namin kayong makasama ngayong araw na to sa ating usapan dito sa ating A2 Information Caravan. Over to you, Lindsay.
Thank you very much po, Yusek, at muli magandang umaga po sa ating participants from the different regions po ng Visayas. Before we proceed to our first presentation, let me recognize po ang ating mga experts na kasama po natin for this morning. We have Dr. Ntf Castillo-Carandang from the National Immunizational Technical Advisory Group. Narito rin po si Dr. Priscilla Sanchez, isang consultant ng Department of Medicine ng the Medical City. We also have Dr. Sara Lazaga from the National Vaccination Operations Center, or NVOC. We also have with us Attorney Franklin M. Quijano, Chairperson of the National Commission on Senior Citizens, and other resource persons present in the call, Dr. Vivian Swansing, OIC Assistant Director of the Bureau of Local Government Supervision, DILG, Ms. Princess Medina, Political Liaison for Luzon, Liga ng mga Barangay sa Pilipinas, Dr. Alfonso Miguel Regala from the Health Promotion Bureau, and Director Alethea de Guzman from the Epidemiology Bureau. I'd also like to recognize yung mga participants po natin from different senior citizen groups, Mr. Oscar Rica Flanca, Secretary General of the Federation of Senior Citizens of the Philippines, Mr. Ben Medina, National President of the Officer for Senior Citizens Affairs, and Mr. Angelito B. Prahides, President of the Senior Citizens Welfare Association of the Philippines. Magandang umaga po sa inyong lahat. Muli, pinapaalala lang po natin sa mga participants na i-mute po muna natin ang ating mga microphones para malinaw po nating mapakinggan ang presentations ng ating mga resource persons. So to give us an overview of the COVID-19 situation for senior citizens, here is Dr. Ntf Castillo-Carandang. Lucky, please play na.
So ang aking pong ibabahagi ngayon is situationer po for senior citizens and the need for vaccination and good information hygiene. So ano po ang kalagayan po natin ngayon? Ano? We have over 1.5 million cases nationwide, and about 13.74% are among seniors. So iba-iba naman hong klase ng COVID ang nadadatnan po ng ating seniors. Meron pong asymptomatic, yung wala pong simptomas. Meron naman bahagya lang po. Meron ding moderate, yung katamtaman po yung nakuha din ng COVID. At meron din naman po yung severe, yung malubha at saka yung critical. Pero sa awa po ng Diyos ay marami pong recovery. So 87.56 ng mga nagkasakit na seniors, 207,000 po, ay naka-recover naman po. Sa kasawiang palad po is meron din po mga namatay na mga lolo, lola, tito, tita. So mga 17,000 po yun, and that's 8.27% po ang namamatay na seniors dahil po sa COVID. Kung titingnan po natin, sa dami po naman ng mga namatay dahil sa COVID sa buong Pilipinas, 26,786. Tulad po ng sabi ko kanina po, 8.27% ay among the senior citizen cases. Mas dumadami po ang bilang na yan kung bibilangin nyo rin po yung senior citizens na nagkaroon po din po ng ibang mga sakit tulad ng hypertension, diabetes, cancer, kung ano man po yung mga sakit nila, nagiging 53.17%. So ano po ang gusto nating ipakita po dito na pag kayo po ay may katandaan na at meron din po kayo mga iba pa pong sakit, ay mas mataas po ang panganib na kayo po ay magkaroon ng malala o malubha na sakit ng COVID, at unfortunately po, meron din hong pagkakataon o risk na maaari ding ikamatay po ito. So kung ihahambing po natin sa pangkalahatan, 1.77% po ang case mortality rate. So ibig sabihin po nun, sa dami po na nagkakasakit ng COVID, 1.77 po ang namamatay. Pero sa COVID, sa seniors po, it's 8 times more. So kung senior ka, at kung meron pang comorbid, cancer, diabetes, hypertension, chronic kidney disease, kung ano man po yon, ay mas mataas po ang inyong risk na maaari po kayong mamatay dahil po sa COVID-19. Ito lang pong slide na ito ay nagpapakita ng number of cases po and total deaths and case fatality rate, yung ibilang po ng mga namamatay dun sa nagkaka-COVID sa lahat po ng rehiyon ng Pilipinas. So nakikita po nyo na iba-iba po ang bilang ng kaso, bilang na namamatay at ang porsyento po ng namamatay kung ihahambing po sa dami ng kaso ng COVID-19 sa mga seniors po natin sa buong Pilipinas. So ito po pinapakita po sa iba't ibang region po yan. Tulad po ng sabi ni Yusek Rosette kanina, is marami din po tayong hinaharap dahil sa mga variants. No? So ang ibig lang pong sabihin nito ay pag may variant po, lalo na po yung pinakabago, yung Delta, ay mas mabilis po siyang kumalat. So highly transmissible. Bakit po natin gusto itong labanan? Dahil maari pong kulangin ang ating healthcare system, kulangin po tayo ng mga kama sa ospital, kulangin din po tayo ng mga manggagamot na mag-aalaga sa atin. Ang aking pong panganay na anak at ang kanyang pamilya ngayon ay nakatira po sa Indonesia at sila po ay naka-lockdown na magtatatlong linggo na. Wala na pong mga ospital, wala na rin pong ambulansya, puno na rin po ang mga sementeryo po nila, pati na po ang kanilang crematorium. So yun po yung sitwasyon dahil po sila ay tinamaan din po ng iba't ibang variant. Ayaw po natin mangyari po yan sa atin. So ano po ang ating gusto dito sa ating pagpapakuna? So safe, ligtas po, equitable, pantay-pantay at cost-effective, sulit po ang pagbabakuna sa lahat ng Pilipino sa year 2023. Sana po mas maaga pa doon ang ating pagkamit ng ating objectives. So ang pangunahing pong goal ng ating bakunahan ay para mabawasan po yung dami na nagkakasakit at namamatay at mapanatili po natin ang pinaka-importante nating mga serbisyo. Kung sa larangan ng kalusugan, sa ekonomiya, sa iba't iba pong sektor natin, pati na po sa edukasyon. Ang pangalawa po nating layunin ay para mapigilan po ang pagdami ng kaso, mabawasan din po natin ang pagkakasagabal sa ating pakikipagsalamuha sa tao, paghahanap buhay, pati na rin po ang pag-aalaga sa ating security. At ang pinakamalayo po nating gustong maabot ay bumalik po tayo dun sa ating mga kinagawian na. Hindi ko po gusto yung term na new normal kasi hindi po tayo natuto ng mga mapait na karanasan na dinaanan po natin dahil sa pandemya. So gusto ko pong hamunin tayong lahat na we all work for a better everyday in a just and humane society po. So ito po yung sinasabi po ni Yusek Rosette kanina na dahil kulang po pa ang ating mga bakuna at meron po iba-ibang grupo po na iba't iba din po ang hinahamon nilang risk, no? Hinaharap na risk dahil sa COVID, kailangan po natin mag-prioritize. So ang una po yung A1, workers in frontline health services. Ito po yung doktor, nurse, medtech, BHERTS po natin. At ito po yung A2, lahat po na ating seniors. A3, persons with comorbidities. A4 is the frontline personnel and so on. Bakit po ganito ang pagkakahabi po nito? Kasi matindi po ang pangangailangan na maprotektahan po lahat. Meron din kapasidad at saka ang ating kakulangan sa 15 million. So kailangan pong isipin po lahat po yan sa pag-allocate ng bakuna sa specific na grupo. So gusto po natin bawasan ang number of cases at mga namamatay po dahil sa COVID-19 while maintaining the most essential services that we need. Ito naman po ang current vaccine coverage. So ito po, tingnan po natin itong sa senior citizens. Ang target po natin is 8.4. Sabihin naman po natin 8.5 kasi alam po namin na marami pong seniors natin na hindi po nakalista sa official list ng senior citizens sa kanilang barangay or sa kanilang bayan. At dito po sa 8.5, the target na milyon, ay 2.7 pa lang po ang may unang bakuna at 1.197 po ang may pangalawang bakuna. So ang ibig po sabihin nito sa seniors, 32.5% pa lang po ang nakakatanggap ng first dose. At 14% lang po ang fully vaccinated. Ibig sabihin po, nakadalawang doses na po sila. Ito po ang nagpapakita ng iba't ibang target population ng seniors. Ilan na po ang nakatanggap ng first dose, ilan na po ang nakatanggap ng second dose, at ito po ay para sa iba't ibang rehiyon din po. So, ulitin ko lang po, ang first dose pa lang po natin sa seniors ay 32.5%. Doon naman po sa second dose is 14.10%. Bakit po mahalaga yung second dose? Wala po kayong full protection kung hindi nyo pa po na kukumpleto ang minumungkahing pagbabakuna. So sa karamihan po ng bakunang available po sa atin, 2 dose po ang minumungkahi. Iisa pa lang po yung bakuna natin na 1 dose lang. So hanggat maaari po, baka akala nyo po, ay bakunado na ako. Pero iisa lang po yun, kulang pa po yun. Kailangan po ay 2, except for 1 vaccine brand na iisa lang po ang dose na recommended sa kanya. Ang DOH po ay nagpa-survey po noong May 16 to 30 ng mga tao hinggil sa kanilang interes na magpabakuna. So doon po sa mga ayaw magpabakuna o nagkukuli po, over 1,000 people, what are the top 3 reasons why you are highly likely and not likely unsure to get vaccinated? Doon po sa mga sabi nilang game po sila na magpabakuna, 88% po yun. Gusto po nila ng protection sa infection. Sila po ay more than willing. Game na po sila. Pero ang vaccine supply is not available, 15%. And then may sumagot din po na nakikita po nila ang COVID-19 is enough of a risk. May panganib po. Kaya sila gusto magpapakuna sa 14%. Doon naman po sa no, not likely, hindi ako magpapapakuna, 2% po yon. Kulang po sila ng tiwala po sa clinical trials o pag-aaral po tungkol sa pag-develop po ng mga bakuna. Ang pangalawa pong dahilan ay ang kanilang mga agam-agam tungkol sa possible side effects ay hindi po natugunan at na-discuss ng maayos. Tapos meron din pong negative news about the vaccine. So sari-sari pong balita, haka-haka. Doon naman po sa not sure, yung 10% po, no? Ganon din po, yung fears nila, concerns about side effects were not properly discussed and addressed din po. May negative news about the vaccine. Pero meron din pong medical reasons. I have comorbidities, allergies to the vaccine. But if you remember po, I showed you figures that if you're a senior citizen and you have comorbidities, the risk of severe COVID or even death is higher. So gusto po nating hiyakatin lahat po na magpapakuna po. Or maaari din pong may primary care provider. Pwede din po ito mga doktor, pwede din anak nyo, pwede mga kasama sa bahay. Ay sabi, huwag ka na magpabakuna. Tay, nay, lolo't lola, matanda ka na eh. O matanda na ako. So may 13% po yun. So ang kakulangan po ng sapat na impormasyon, ay isang dahilan kung bakit po nag-aagam-agam ang mga seniors natin sa pagpapabakuna. Doon naman po sa na-schedule na po pero hindi nakadating o nakabakuna na ng number 1 pero yung number 2 po ay hindi po natutuloy. Ang mga dahilan po galing sa National COVID-19 Vaccination Operation Center natin ay maari po nagkasakit po sila nung schedule nila, na-expose po sila sa someone who is positive for COVID at sila po ay nagko-quarantine. So ito po yung kadahilanan ng pag-defer nila ng schedule ng bakuna. Ang social weather stations po at ang Pulse Asia ay nagpatakbo ng survey recently nung pareho po nitong June, no? Kung ano po ang willingness magpabakuna. So ang willing magpabakuna sa SWS at sa Pulse Asia halos pareho po, about 45 to 43%. Ang hindi sigurado, mas marami po doon sa sumali po sa social weather stations versus doon po sa Pulse Asia, so 16 and 24%. Doon naman po sa hindi gusto, 21% no sa social weather stations at 36% naman po sa Pulse Asia. Pero ang maganda din ng balita dito ay bumaba na po yung number na ayaw po magpapakuna sa both surveys compare po dun sa Mayo at February nilang survey respectively. At meron na pong mga sumagot, lumahok sa survey na bakunado na po sila. So sa social weather stations, 10% of those respondents bakado na po versus the Pulse Asia 5%. So ito lang po ang snapshot kung ano po yung mga sabi din po ng iba pong taong sumali sa mga survey na ginawa po ng ibang ahensya, hindi po ng Department of Health. Sa Pulse Asia survey, gusto ko lang pong i-share po sa inyo. Primary why you are not vaccinated, so not sure of safety. Vaccine might not be effective. A vaccine is not needed to combat COVID-19. It might not be free, might be costly or expensive. So ang lahat po ng pinag-aralan pong bakuna na nakakuha na po ng emergency use authorization ay ligtas, dumaan ho sa pagsusuri, at kung kayo po ay magpapabakuna sa inyong LGU ay libre po ito. Tingnan niyo po itong rason na ito, no? Senior na ako kaya ayoko na magpapakuna. Meron po akong mensahe para dyan mamaya-maya po. So mga paalala po at pakiusap. We need to practice good information hygiene to help reduce the spread of false information. Ano ba yung information hygiene? Ang pag-share po natin, pagla-like, ng mga bali-balita na hindi naman po proven, wala pong ebidensya, or haka-haka lang, or an exaggeration. So we need to be proactive about what you like and share online to have a positive impact on others. Pag tayo po ay nag-like at nag-share, at nagkwento din tayo mga kaibigan, kapitbahay, kapamilya, may epekto po yon sa kanila. Kasi nakikinig po sila, lalo na po kung ang mga lolo at lola natin, tito, tita, ate, kuya, ang sasabi po noon. We have responsibilities as creators. Tayo po ang nagkukwento. At sharers. Tayo po ang nagbabahagi ng informasyon. So kailangan po natin ng information hygiene. Kung tayo po ay may personal hygiene, naliligo po tayo, nag-aalaga tayo ng ating katawan, kailangan din po ang pangangalaga natin ngayon sa gitna ng pandemya. Kasi meron din po tayong infodemic. Ang pagkalat po ng impormasyon na hindi naman po tama o wala pong basihan na ebidensya. So, SIFT model. Yung SIFT po,
Apologies po. I think we're experiencing a little technical problem lang po.
Filipino po. So stop, best find trace. So pag kayo po ay nakatanggap ng bali-balita, kwento-kwento, nakakita po ng impormasyon, bigla kayo nagulat o nagalit kayo, nainis kayo, namangha kayo, hinto muna po kayo. Baka naman ho exaggeration po yon o kailangan alamin nyo pa muna kung ano ba talaga ang kwentong yon. Yung second po is investigate the source. So saan ba nanggagaling? Alamin po natin kung saan po nanggagaling ang kwento-kwentong pong ito. Tapos pangatlo po is find better or alternative coverage. Kung masyado po mukhang sensational or exaggerated po or kamangmangha o kagalit-galit, katuwa-tuwa ang balitang yon, kailangan po nating hanapin kung meron pang iba pang paliwanag, iba pang sources ng tungkol sa kwentong nakita po nito. At ang huli po is trace. Balikan po natin, sundan, saan ba nanggaling ang original konteksto ng kwentong po yun. So tandaan po natin, we have responsibilities as creators. Tayo po ang pinanggagalingan ng kwento and sharers of information. Responsibilidad po natin yon sa ating kapwa so that we have a positive impact on other people. Saan po tayo mag-check ng information? Ang DOH at marami pang ibang evidence-based and reliable sources tulad ng World Health Organization po ay marami pong impormasyon. So meron silang fake facts sa DOH, fake news, check the facts. Meron din po silang mga social media cards na nagpapaalala po sa atin ng mga tamang pagkilos po at tamang impormasyon. So ito po, nais ko pong ibahagi sa inyo ang aking pulsa framework, lab kita, halina, at magpabakuna. Kailangan pong pulsuhan natin ang ating sarili, ang ating mga kasama, kausap, kapamilya, kapitbahay. Alamin ang mga agam-agam at katanungan. Tugunan po natin ang mga katanungan na ito. Makipag-usap po tayo, makipagdialogo at yakapin po natin. Kailangan po tayong physically distant but socially connected. So virtual hug na lang po or pakaway-kaway na lang or fist bump po tayo. No? Bakit po kailangan natin gawin lahat po ito? Para meron tayong vaccine literate and vaccine protected public. Kailangan alamin po natin kung ano pang bakuna ang inaalok sa atin bago natin pasyahan na tayo po ay tatanggap ng bakuna. Para po lahat tayo ay protektado laban
Lindsay?
Hello po, Yusek.
I think that's
I think-
the last slide of Dr. Nina. Can we move on to the next?
Sige po, Doc. Apologies po to our participants. Nagkakaroon lang po tayo ng ilang technical difficulties. So gusto ko lang po ulit i-reiterate yung message po ni Dr. Ranina na we should all be proactive and responsible po when it comes to resharing of mga information po natin, especially sa social media po as it affects po yung decision making din of course ng ating mga friends, mga families po. So I'd also like to emphasize po na pinakita po sa presentation niya yung need talaga po natin na tutukan ng ating mga lolo at lola para sa vaccination. So for our next presentation po, to further emphasize the need po na para matutukan po ang ating mga senior citizens to prioritize them to our COVID-19 vaccination program. Here is Dr. Priscilla Sanchez, consultant from the Department of Medicine of the Medical City. Magandang umaga po, Dr. Sanchez.
Good morning. Can we start my slides, please?
Team, please share the slides. Thank you.
Good morning, everybody. Maraming salamat po sa DOH sa pag-iimbita po sa amin. Para lang po mapaalam po yung konti naming napag-aralan over the many years that we've been studying the elderly. Para lang po i-reiterate po sa lahat kung bakit po napaka-importanteng mabakunahan po ang senior citizens po. So, my focus will be less on COVID rather than, I will be talking more about geriatric principles po para po maintindihan po kung saan ang gagaling yung vulnerability ng senior citizens to illnesses such as COVID. So for the first slide, makikita po natin dito, first slide please, that the global population has been growing rapidly over the past century. There have been shifts in epidemiology showing a rapid increase in the proportion of persons aged 65 and over. As recently as 2010, 11% of the global population was consisted of people over the age of 65. And this is expected to increase to 32% by the year 2100. So isa sa tatlong tao by the year 2100 will be over the age of 65. Nakikita nyo rin po dito sa graphs na to that there is a transition from a pyramidal shape description of the populations of the world in 1950 na nagiging bullet shape po, mukhang bala na po by 2050 and 2100. Ang nakikita po dito sa mga graphs na to ay dumadami talaga ang numero ng mga senior citizens as time passes, pati na rin po yung life expectancy. From maximum life expectancy, umaabot na po ng lampas 100 by the year 2050 and 2010. In the next slide, according to the World Population Aging Report of 2017, nakikita natin that in 1980, people over 60 was total number was 382 million. And by 2017, almost 1 billion na. And by 2050 po, dodoble pa rin po to 2.1 billion. And so it's easy to imagine what a challenge this will be to public health in the future. For the next slide, we look at the results of the 2020 census conducted by the Philippine Statistics Authority, which showed, next slide please, that 10% of the total population of the Philippines consists of people 55 and older. So of these, 5% are 65 years and older. Next slide, please. We go on to definitions of aging. No? Ang aging po is defined as a gradual accumulation of damage. May wear and tear po. Konti-konti pong nasisira yung mga cells natin, pati yung mga molecules, which leads to a decline in our physical well-being as well as our mental health po. And then when there is a decline in this capacity, meron pong disordered homeostasis. Ibig sabihin, nawawalan po ng balanse yung mga bodily systems of older people. Ang ibig sabihin po ay tumataas po yung susceptibility to illness, disability, and even death po. So we know these. Next slide. Pero po, these changes over time lead to a wide variety of presentations. And the next slide emphasizes the diversity of the elderly people and the environments in which they live. Next slide, please. Yes. So hindi naman po lahat pareho, no? Just like all other age populations, there is diversity. Not previous slide, hindi pa po ako tapos dun sa previous slide. Previous slide, please. Can we go back to the previous slide, please? I'm still talking about diversity. Okay, anyway, I was talking about the diversity of the elderly people. Okay, good, thank you. Some people remain healthy for a long period of time, for the majority of their lives. And they sustain illness only at the very end of their lives, which is something that we like to do. As geriatricians, gusto po namin mahaba yung period of functionality and independence, dun lang po sa kaduluduluhan ng buhay yung nagkakasakit talaga. But there are also some people na merong mga comorbidities like hypertension, diabetes, asthma, COPD, na yung iba very controlled, yung iba hindi masyadong controlled. So once in a while po, nagkakaroon ng hospitalizations from which they recover, maybe partially only or fully to their previous level of functioning. But there are others who suffer from early complications. Yung nagkaka-stroke na sa 40s pa lang, 50s pa lang, na medyo mahaba po yung period of disability and dependence. So this is something that we really want to avoid. These physical changes also can be modified by transitions in life like retirement, relocation, or pagkamatay po ng asawa, close friends. So pati po itong mga conditions like this can lead to potentially serious consequences. So next slide, please. The accumulation of risk factors and then repeated cycles of illness with partial recovery and increasing age can lead to a condition known as frailty, okay, which is almost synonymous with vulnerability. Next slide, please. So ang frailty po is clinical state of increased vulnerability. So the older patient is less likely to maintain balance in the bodily systems. So there is a decline in function. Can I have the next slide, please? May I have the next slide, please? So the predictors of frailty would include unintended weight loss, muscle weakness, and there's fatigue, gait difficulties, and progressive functional decline. Ang ibig sabihin po ng functional decline is that there are certain things na dati kayang-kayang gawin, from using the telephone, from cooking, or maintaining their finances, na little by little nagle-lessen over time. Okay. Please stay in this slide for a while. No? There are certain concepts in frailty that are associated with the development of vulnerability. No? And ang una na dito is yung tinatawag na immunosenescence. This is an age-related reduction in the ability of the older patient to mount an immune response. So usually yung tinatawag na T cells tsaka natural killer cells, ito po yung pinaka-apektado dito sa immunosenescence. Ang ibig sabihin lang po is that they become really more vulnerable to infections, even cancer, even cardiovascular diseases like thrombosis, heart attacks, and strokes. And then kasama din po dito is inflammaging. This is a concept in geriatrics, which is a chronic low-grade inflammatory condition na wala namang overt infection, which is said to be seen in all older patients. Kasi po, this chronic inflammation will lead to tissue degeneration. Hindi naman po nakikita, minsan naman po, wala naman pong nararamdaman yung pasyente, pero po, the moment a trauma occurs, like a fracture or getting an infection like COVID, bigla na lang po nagiging trigger ito for a cascade of events that can lead to further organ and tissue damage. Now, there are also physiologic changes of aging, which affect all the organ systems. The heart, the lungs, the kidneys, the brain, the muscles, the skeletal system. And when these happen, there is an increased likelihood of developing yung comorbidities that we know, that we've heard of, such as hypertension, coronary artery disease. So this is mediated naman by genetics and environment as well. The atypical presentation of disease is very important because it predisposes to delayed detection and management of disease. The way older patients manifest disease is different from a younger person, or a little bit out of the norm. So you need a high index of suspicion. And so sometimes po, especially in the time of COVID, there already is significant organ system damage before intervention occurs. Nakikita po natin dito na nadadala minsan sa ospital, medyo talagang naghihingalo na. And when that happens, when it's combined po with disturbed balance, yung disturbed homeostasis, minsan po even with maximal interventions, mahirap na mabalik sa dati. The response is very slow and oftentimes incomplete. Sometimes this is a trigger for a downward spiral into permanent disability and even death. So next slide, please. Regarding the atypical presentation of illness. There. Okay, a review of the most common signs and symptoms of COVID in the elderly was published in May 2020. And they are the following. Somnolence, yung tulog ng tulog. Anorexia, yung ayaw kumain, nawala ng gana kumain, which leads, of course, to protein-calorie malnutrition and, of course, dehydration. And others are sore throat, delirium, unexplained hypoxia, or low oxygen levels, pagbilis ng heart rate, tsaka yung pagbilis ng paghinga. Ngayon, obvious na ito sa atin. I mean, when a person, an elderly person presents to the emergency room with these symptoms, almost automatically, you rule out COVID. Huh? But back then, this came out in May 2020. So, ano pa siya, masyadong clear. We tended to look for other explanations. But these are very commonly seen now in COVID patients. So this means that we need to think outside the box and being alert for changes out of the usual. Kasi kung for the elderly, a functional change or a change in consciousness or level of activity sometimes is the only signal we have that there's something wrong and that something needs to be investigated. Okay, next, please. It's an acknowledgement of these pathways to vulnerability and frailty that the WHO in 2015 began promoting awareness of the concept of healthy aging. So healthy aging po, hindi lang po yung walang sakit. Kasi hindi naman po natin nakikita yan ng madalas sa mga older patients. Usually an older patient would have a comorbidity. So So the WHO would define healthy aging as the process of developing and maintaining functional ability. So it's always function, the ability to do certain things. And functional ability is a combination of two things, yung intrinsic capacity na tinatawag, which consists of genetics, the health characteristics of the person, as well as the personal characteristics such as gender, and of course, this one in combination with the environment would determine yung functional ability ng older patient. A strong functional ability would lead to resilience. Ang ibig sabihin, the older patient is able to bounce back from traumas, from infections, from debilitating disease. So over time po, intrinsic capacity tends to decrease. Kasi tumatanda tayo, the physiological factors set in, physiological changes, and diseases really happen. But even then, functional ability can be maintained or even increased in the presence of a supportive environment, both at home and in the community. So that means the person has access to food and medication and healthcare, and of course, the support of a loving family. But obviously, this global pandemic has really interfered greatly with the older person's ability to build resilience and has done much to damage yung functional ability natin. So, because it has attacked almost all aspects of our lives. Next slide, please. There have been changes that have occurred. So comorbid factors have become less controlled. Yung high blood po has been worsening. Diabetes has been worsening, partly because of circumstances or decreased access to healthcare and medication. Yeah. So according to the Fit for Frail study of 2021, conducted by the NIH under Dr. Shelley De La Vega, these are significant risk factors among older Filipinos, which may put them at higher risk for developing COVID. They are hypertension, diabetes, obesity, tobacco smokers, living alone, and dependency. So controlling these conditions will build resilience and enable the older person to cope with the threat of communicable diseases such as COVID. Okay, next slide, please. We have seen that there's an obvious progression in non-communicable diseases such as hypertension, diabetes, and obesity. Can you click again there? So they have become less poorly controlled over the past 16 months because on healthcare po, the focus has really been on COVID, and it's only now that we're really trying to pull back a little bit so that we can go back to taking care of the people who do not have COVID, those who have hypertension, who have diabetes, who may have chronic kidney disease, who need dialysis. And then contributory also to disease progression is a change in the lifestyle brought about by lockdown, such as reduction in exercise, physical activity, maybe increased use of nicotine and alcohol, and certain segments of the society may have limited access to nutrition, to medication, and which can lead to physical deterioration. Included also here is social isolation, which can involve loss of income and even poverty. There's also long COVID, yung tinatawag na long COVID, in which you have prolonged physical and psychological effects after having gotten sick of COVID early on. Next slide, please. So one of the first facts that arose early in this pandemic is how the most catastrophic effects of the infection became most evident in the older patients. Another click, please. There's another graph there. They are much more likely to require hospitalization and to die from it. That pattern has continued to hold true up to the present, almost a year and a half since the pandemic began, despite advances in research, tsaka bago na namang avenues for treatment options. So we can see from these graphs that deaths from COVID still occur most commonly among the elderly. Next slide. So from the preceding slides, it's obvious that COVID does have potentially devastating effects on the elderly, interfering with resilience and leading to lasting disability like long COVID. That's why it's more important than ever to institute preventive measures. So primary prevention, which is on the left side of the slide, lifestyle measures are predominant. So it's, as doctors, as healthcare workers, it's important for us to keep reminding the population about the necessity for these measures. Kahit na magmukha tayong makulit, we have to stress the importance of proper nutrition, exercise, and avoidance of vices like smoking. And these are from as early an age as possible, we should be stressing these. To reduce the risk of many infectious diseases, of course, we need vaccination. COVID is certainly not an exception to the need for vaccination. It is essential to institute vaccination to everybody, all senior citizens. Secondary prevention is the prevention of complications from diseases that have already set in. Like kung magka-hypertension na, pwedeng magka-stroke, magka-heart attack, we want to prevent these. So it's important to regularly monitor the risk factors. And kung tumataas ang BP, di aayusin yung gamot, magle-lessen ng salt intake, fatty food intake. If the blood sugar is rising, then medication adjustments, changes in lifestyle. Weight management, compliance with medications, regular consultations with doctors, which was difficult before, but it's a bit easier now because pwede na pong mag-online consultations. Also, continue lifestyle measures, always important. So for the next slide, I just wanted to show that vaccination has many benefits. And in the context of COVID, these benefits should be reiterated because it will reduce the risk of disease and complications and even death. And life can go on in the sense that you can continue working and you protect others around you, your loved ones and your co-workers. And it is a very important way in which healthy aging can be attained. Next slide. COVID vaccines are recommended for seniors, so much so that they are a priority group for the vaccination program, just behind the frontline healthcare workers. The vaccines are generally safe and side effects occur only in a very small number of patients. So we have to reiterate that talaga, that vaccines are generally safe. And current statistics, particularly in the US, show that COVID infections are higher in unvaccinated populations rather than in the vaccinated populations. So for the last slide, here's a final reminder regarding the best protective measures against COVID. Healthy aging, which stresses physical, psychological, social, and environmental well-being. Continuing the preventive measures, the apat dapat, with the face mask, the physical distancing, air circulation, and limiting interactions to 30 minutes or less, and above all, vaccination. So I think that's my last slide. Thank you so much.
Thank you very much po, Doc Priscilla, for your very informative presentation. So hopefully nakita po natin yung importance po, no, kung bakit po talaga nating pina-prioritize ang ating mga senior citizens bilang sila po ay very vulnerable to severe COVID-19. So since po ang ating participants po sa town hall today ay from different barangays po ng ating Visayas region, sana po matulungan niyo po kami at ang ating mga experts para tangkilikin pa ang ating national vaccination program. So to further provide different advisories, here is Dr. Sara Lazaga from the National Vaccines Operations Center to discuss yung mga bilin pa po natin and different policies po when it comes to vaccinating our senior citizens. Good morning po, Doc Sara.
Good morning, everyone. Good morning, Lindsay. May I please share my screen? Thank you. Okay, so magandang umaga po sa inyong lahat. Ako po si Dr. Sara Lizaga from the National Vaccination Operations Center. I am tasked by Dr. KZ Rosario to give this presentation on the National Vaccine Operations Center advisories for Tutok A2. So can everyone see my screen po? And can I be heard clearly?
Yes, Doc, very clear
Okay,
po.
thank you very much. Okay, so let us now first proceed to the vaccination coverage for our priority group A2. This is the data as of July 20, 2021, 6 p.m. So as of, so for the master listed A2, we have 8.4 million master listed priority group A2, and so far we have vaccinated 32.7%, or that's 2,781,000 senior citizens for first dose. No? For those who have completed their second dose, this is already 14% or 1.2 million senior citizens. To give us a more graphical representation of this coverage, this is for the first dose of priority group A2. So overall, our country has vaccinated 32% or 32.7% priority group A2. For NCR, this has the highest coverage at 61%. This is followed by Region 4A with 43%. Okay, so we can see that there are still a lot of regions that have still to ramp up their vaccination for priority group A2. So namely regions 5, BORM, 6, and Mimaropa. So this slide shows us the first and second dose completion rates for priority group A2. So as we can see here, this is for Sinovac, AstraZeneca, Gamaleya, Pfizer, and Moderna. So as we can see for Sinovac, we have a 65% completion rate. So these are the people or the senior citizens that have already received their second dose of vaccination. We can also note here that for AstraZeneca, only 8% have completed their second dose. So this is because we have started our AstraZeneca vaccination for senior citizens in last May 15, and our senior citizens are due for their second dose for August, in August. So that's a 12 weeks interval. So they are still awaiting for their schedule, and that is the reason why we have still a low completion rate for AstraZeneca. We can see here in Gamaleya, we have 47% completion rate, and for Pfizer, 59% completion rate. So these are at pace with our vaccination program. So overall, we have a 45% completion rate for our senior citizens. Okay, so we would like to emphasize the following advisories that were issued. So as early as April 29, the NVOC advisory number 33 was issued. So this is with regards to the additional directives on the vaccination rollout for COVID-19 vaccines. So in particular, this advisory aims to contextualize the vaccination specifically for priority group A2. So for example, we would like family members to assist our senior citizens in going to vaccination sites, especially because they have problems with mobility. So our vaccination sites may also have additional measures or engineering controls to adapt to the needs of our senior citizens. So such as safe and spacious walking lanes, presence of wheelchairs and handbars and handrails, as well as the presence of ushers or usherettes during the vaccination program. So we would also like to reiterate in this advisory that since we are already ramping up our vaccination with other priority groups, such as priority groups A1, A2, A3, A4, and A5, there should be priority lanes, no, for our most vulnerable, which are the A2 and A3, no, specifically for A2 because they are the ones who have problems with mobility, no, so they should have priority lanes in vaccination sites. Also, we would like to reiterate NVOC Advisory Number 48. This was issued last May 27. So this advisory just gives us specific suggestions on how we can ramp up our vaccination for this priority group. So namely, for hospitals or medical centers that are vaccination sites, they can vaccinate their dependents, so specifically the dependents of healthcare workers under priority group A2. So these are our senior citizens. We would also like to reiterate that LVOCs may coordinate with their OSCA and as well as the homeowners associations to look for the senior citizens that have not yet been vaccinated. So as mentioned earlier, the priority lanes, as well as the immediate scheduling of all pre-registered or master listed priority group A2. So in previous discussions with senior citizens in the last few weeks, we have gathered that some senior citizens are already pre-registered online. However, they are still awaiting for their schedules. So we would like to ask specifically our local government units, our barangays, to prioritize our A2s. If you have seen that in your area, there are still senior citizens that have not yet been vaccinated, schedule them immediately, so that we won't be missing them out, in our campaign. So we would also like to help our senior citizens in accessing our vaccination sites by providing transportation, to our senior citizens. So we can partner with private companies, with different societies that could help in providing, the travel, to increase the mobilization of our senior citizens to the vaccination sites. We also want to reiterate that LGUs may provide incentives, to our senior citizens who are willing to be vaccinated. Next is the Department Memorandum 2021-0286. So this is the interim operational guidelines for the implementation of Tutok A2. So this Department Memorandum states the different deployment strategies to improve our vaccination for A2. So namely, these are the mobile vaccination strategies, as well as the temporary post, for our senior citizens who are in home for the aged or in convents or in subdivisions that are far from the vaccination sites. So our implementing units can utilize these strategies, to improve the vaccination of our A2. Okay, next, these are the Ntf Memorandum 7. So this was issued by Secretary Carlito Galvez, our vaccine czar and chief implementer, to Secretary Eduardo Año of the DILG. So he stated here the various strategies, to improve or to address the hesitancies among senior citizens. So this includes the exclusive lanes or priority groups, priority lanes for senior citizens. This also includes the scheduling through SMS or Viber of senior citizens. This also includes the pop-up sites or the barangay registration for non-online options, and also the home visits for our bedridden senior citizens. We also have Ntf Memorandum 8, which was issued last June 17. So this was also from Secretary Galvez to the various departments such as the Civil Service Commission, the DILG, the Department of Labor and Employment, and DTI, Department of Education, CHED, and TESDA, as well as DSWD, to monitor the COVID-19 vaccine demand generation and communication activities for priority group A2, no? So, okay. Moving on, this is NVOC advisory number 68. For NVOC advisory 68, we would like to say here that there's a directive on the allocation and utilization of the Janssen COVID-19 vaccine. So what is unique about the Janssen vaccine is that it only requires one dose, no, to be able to say that we have already been vaccinated completely, no, with COVID. So with that, we would like to strictly prioritize the Janssen COVID-19 vaccines to the remaining unvaccinated priority groups A2 and A3. We would also like to allocate these vaccines to the high-risk population, especially in densely populated areas, no? As well as in high risk for COVID-19. We also like to emphasize here that this vaccine can be given most especially, no, to GIDA areas, or the geographically isolated and disadvantaged areas. So they won't be requiring parang additional, they won't be requiring parang a second dose, no? So because our Janssen vaccine only has one dose, no? And dahil po doon, completely vaccinated na po ang makaka-receive nito. So here are the specific Tutok A2 strategies. So as mentioned po, our Health Promo Bureau conducted a survey last May 16 to 30 regarding the senior citizens' sources of messaging, no? So they completely trust the messaging from their family members, their family doctors, their peers and their fellow senior citizens, their churches and local community organizations, as well as the relatable celebrities, and of course, the Viber and group chat with peers. So with that, we would like to emphasize, no, that there should be strong demand generation and communication, no, about COVID-19 vaccine. So we want to continue our dialogues with senior citizens and to engage the OSCA as well as the senior citizens groups and caregivers to strengthen, no, the communication with our senior citizens. And we would also like to empower the family members to be advocates, no, in the vaccination campaign, to encourage more Lolas and Lolos to get vaccinated, no? And of course, to explore creative and appropriate means to communicate, no, with our elderly population. So as mentioned kanina, these are also the strategies on the pre-registration and master listing. So we ask our barangays to conduct barangay level assisted or house-to-house pre-registration to establish, no, to ensure that all our senior citizens are already pre-registered and scheduled for vaccination, and also to work closely with OSCA and to immediately schedule those who are already pre-registered. So we would also like to improve the access. So as mentioned kanina, we arrange the transport system and the schedule and pick up for our senior citizens. And we would also like to give priority lanes, no, to our senior citizens. Also, if there are senior citizens who present or who go to the vaccination sites without other documents to show, we can somehow loosen our requirements for them in order for them to be vaccinated right there and then, no? So since they are willing to already get their vaccination, all they just need to present is probably a senior citizen card, no? Okay. And also to allow reservation of slots through SMS and Viber. So this was already mentioned kanina po, the strategies on vaccination implementation. So here are our directives, no? So we hope to accomplish 95% coverage of priority group A2 by the end of July 2021. For NCR, our goal is to vaccinate 70% of the remaining unvaccinated priority group A2, and for the remaining regions, 40%, no? So so far for region 4A, they have already reached more than 40%, no? But for the other regions po, they are still to ramp up their vaccination for A2. So hopefully po, we can achieve these targets in order for us to protect our most beloved and most valuable sectors in our population, our parents, our lolas and lolos, no? Especially with the incoming threat of the Delta variant, we would like to really ramp up, no? And to strengthen our vaccination program for our priority group A2. So with that po, I would like to end my presentation. Thank you very much po for listening and good morning po to all.
Maraming salamat po, Doc Sara, no, for reiterating the policies and other advisories that will help our implementers on the ground to further increase yung coverage ng vaccination ng ating senior citizens. So sana po yung mga officials natin from the barangay and from the LGUs ay pagtuunan po talaga natin ng pansin para maihatid ang mga bakuna sa ating mga senior citizens. Nakapagbigay po ng mga advisories sina Sec Anyo, ang ating NVOC, para po maipatupad yung iba't ibang strategies para mas mapalawak pa natin at mas mahikayat pa natin ang vaccine coverage sa ating mga lolo at lola. So to our resource persons and to our speakers po, I will now be going through the questions sent through our social media accounts and through our chat box here sa Zoom po. For the first question po, I would like to direct this to Yusek Rosette. Yusek, may question po tayo from Miss Catherine Velasquez. Good morning po. Will the COVID-19 vaccination for the senior citizens be mandatory? And what if the senior citizens refuse? Will they have to sign a waiver? Totoo daw po ba, Yusek, when a senior citizen have his or her vaccination, will they be needing a waiver before their first dose?
Thank you, Lindsay, at magandang umaga po sa inyo lahat muli. Unang-una, hindi po tayo mandatory. Lahat po ng ating vaccination program dito sa COVID-19 sa ating bansa is purely voluntary. Hinihingan po tayo ng informed consent bago po tayo bakunahan. Ito pong informed consent na to, nakasaad dito yung mga benepisyo ng pagbabakuna at saka yung risk involved po kapag tayo ay binakunahan. Ito pong informed consent ay hinihingi po natin sa lahat ng binabakunahan, hindi lang po sa senior citizens, because ito pong mga bakuna ngayon na meron tayo ngayon dito sa ating bansa and even globally are all under the Emergency Use Authority. Ang ibig sabihin po nito, itong mga bakunang ito, hindi pa po sila tapos dun sa tinatawag natin stages ng clinical trials. Ang natapos pa lang po ay hanggang phase 3 ng clinical trials, ngunit dahil may public health emergency at saka nasuri naman po maigi ng ating mga eksperto based on clinical trials na maari nang gamitin dahil ligtas at makakaprotekta na itong mga bakuna, ito po ay pinayagan ng magamit ng iba't ibang bansa kasama po ang Pilipinas. Ngayon po may real world effectiveness data na po. Ibig sabihin ng real world effectiveness data, ito po yung pinag-aaralan na yung mga nabakunahan na mismo sa populasyon ng mga COVID-19 vaccines. At nakakapagpakita na po itong ating mga bakuna, lahat ng meron tayo ngayon sa ating bansa, ng mataas po na effectiveness for protection for COVID-19, especially against severe infections, hospitalizations, and deaths. Yun pong waiver na hinihingi sa inyo ng inyong mga local governments kapag tayo ay nag-refuse magpabakuna, ito po ay hinihingi siguro sa inyo ng local governments just for them to have that documentation na kayo po ay napagpaliwanagan at ngunit kayo pa rin po ay nag-refuse na magpabakuna. But this is really not something na binigay as a general protocol ng national government. This will depend on each of the local governments so that they have their adequate documentation. Ang sinasabi lang ho namin ngayon, ito po ay purely voluntary, wala hong nagpipilit. Pero sana naiintindihan po natin lahat ang kahalagahan ngayon ng bakuna na meron tayo para proteksyonan po tayong lahat, lalong-lalo na po ang ating mga lolo at lola. Lindsay?
Maraming salamat po, Yusek. For the next question po, I'll be addressing this to Doc Nina and to Doc Priscilla po. Doc Nina, if you are vaccinated daw po for 2 doses, is this a guarantee that we will not be affected by COVID-19 anymore? And for Doc Priscilla po, what brand of vaccine do you recommend for those senior citizens who have comorbidities?
Thank you for the question. Maganda tanghali po sa ating lahat. At para po dun sa mga nanonood kanina, yung aking talk was also in the earlier webinar, so you could refer to the earlier video, no? Kasi paputol-putol daw po ang internet sa DOH. At baha daw po doon ngayon. So that's one. Sasagot po sa tanong po ni...
Alam mo magalang ba? Di ka tayong magalang.
May we request everyone to mute po muna para marinig po natin ng maayos ang ating speakers po. Salamat.
Lindsay, pakitanong mo nga uli, nawala yung aking trend of thought.
Sige po, Doc. Doc, may nagtatanong po if we are vaccinated daw po for 2 doses or if we have completed yung vaccine doses natin, is this a guarantee that we will not be affected by COVID-19 anymore or hindi na daw po tayo magkakaroon?
So, most of our vaccines po, tulad po ng paniliwanag kanina, ay 2 doses po ang recommendation. Meron pong isang bakuna na may emergency use authorization na 1 dose lang po ang recommended sa kanya. So kung kayo po ay nakumpleto ninyo po ang inyong 2 doses or 1 dose for that particular vaccine brand, kayo po ay may dagdag na proteksyon against COVID-19. Pero tandaan po natin, ang sakit po na ito ay very complex, no? And dagdag lang po na proteksyon ang COVID-19, kailangan pa po mag-physical distancing po tayo but socially connected. Kailangan po tayo good ventilation pa rin. Kailangan pa rin tayong hand hygiene, good physical hygiene, good nutrition. Kailangan pa rin po tayong tama ang paggamit po na ating face mask. Ang face mask po ay hindi kwintas, hindi po siya necklace. Kailangan po tama ang pagkakagamit. Tama din po ang pagkakagamit natin ng ating face shield. Ang face shield po ay hindi headband. Kailangan pong tama din po ang gamit. So dagdag po na proteksyon ang bakuna, pero lahat po ng aking binanggit ay kailangan pa rin nating gawin na tama at saka consistently. Yung consistently po, importante din po yan. Pag may nakasilip lang sa inyo, saka nyo isusuot ng tama ang face mask or ang face shield. Dapat po palagian po natin maging habit po yung lahat ng yon, pati po ang pagkain po ng masustansyang pagkain at ang ating pong pag-ehersisyo. Thank you.
Maraming salamat po, Doc Nina. For Doc Priscilla po, Doc, ano daw pong brand of vaccine do you recommend for those senior citizens who have comorbidities?
Yung mga available brands natin, wala po tayong pinipili for now that will say na one brand is reserved only for senior citizens. Lahat po ng available vaccines pwede po sa senior citizens with comorbidities or without comorbidities, because proven naman po silang lahat na nakakapag-depensa against severe disease. Yun po yung pinaka-importanteng aspeto ng pagbabakuna kontra COVID. Protection against severe disease and death. So kahit ano pong brand na maging available, pwede po sa inyo yun. Pwede po sa senior citizens. For now, hindi pa tayo namimili. Thank you.
Thank you very much po, ma'am. So to reiterate, all vaccines that we have now have undergone yung ating regulatory approval and are safe and effective po against severe COVID and hospitalization. So for the next question po, I'll be directing to Doc Sara. Doc Sara, may mga ilang questions po tayo from our Facebook users na until now they're asking po, paano daw po yung process of registration natin and scheduling for vaccination? Kasi may mga ilan daw po na hindi pa rin sila aware of the process, hindi sila makapag-register sa kanilang mga LGUs.
Ma'am Lindsay, apologies. Can you kindly repeat po your question? It came in choppy po in my end. Thank you.
Sige po. Doc, may mga several questions po tayo sa Facebook from our viewers na nagtatanong po sila on how can they register pa rin po so that they can be scheduled for vaccination. If we could reiterate and clarify yung proseso lang po. Kasi many are willing to get vaccinated po, pero yun nga, parang nahihirapan daw po sila when it comes to registration.
So how, the question is how they can pre-register online?
Yes po.
Okay, so they just proceed. What they can do po is to contact their local government units po, no? And either through online means or if hindi po nila ma-access through online, they can also call their city health office po to schedule, no? But right now, since yun nga po, one of the challenges that we see is yung scheduling po, no? We are asking our LGUs talaga to really prioritize, no, our senior citizens because iyan po talaga yung sinasabi nilang problem. They have been waiting for many months already, waiting to be vaccinated po, no? So we are asking our implementors, no, to please prioritize them.
Thank you po,
Thank you
Doc
po.
Zara. Thank you po, Doc. So I'll be calling po yung mga participants natin dito sa Zoom na nag-raise po ng hand. Let me begin with Miss Filipina Cuevas po. You are now recognized, ma'am. Ma'am, I think nakamute pa rin po kayo.
Ma'am Linz?
Ayan na po.
Welcome po, ma'am.
Ma'am, you may raise your question na po if may question po kayo for or clarification sa ating speakers.
Wala naman po, ma'am.
Okay, thank you po. How about Ma'am Alicia Roque po? You're also raising your hand, ma'am. Do you have questions po sa ating speakers and experts? I guess wala din na pong question si Ma'am Alicia. For the next question po, I'll be directing this again to Doc Nina. Doc Nina, if you could explain po how vaccines work para daw po maintindihan po ng mga tao. And to Doc Priscilla din po if you will have a rejoinder po.
I would like you to redirect that question, Lindsay, to Dr. Sanchez. No, I'm not a medical doctor, so she is
Sige
in a
po,
better
Doc.
position to answer. Thank
Thank you,
you.
Doc. Doc Priscilla po, parang they're asking daw po, paano daw po ba nagwo-work yung bakuna sa ating katawan po? Para po maintindihan po ng ating viewers.
Okay. Ang proseso ng vaccination po is to induce po an immune response para po yung sariling pangangatawan natin will develop the necessary antibodies tsaka iba pang mga cells na nakakapaglaban doon sa viral the virus that from which the vaccine is derived. So it's ano lang po, parang isang way lang po ito para yung sarili nating system, our own body, is able to defend itself from this infection. So ano po yan? The viral particle that is included in the vaccines, in some of the vaccines, are killed vaccines po. Hindi po sila mag-i-induce ng widespread infection, but it will cause the immune system of the person to develop a way to protect itself from that virus from which that particle came from. So I don't know if that's a simple enough explanation. Pero ganun po yun. That's how a vaccine works. And some of the vaccines are newer in technology. Mas mahirap po i-explain yon. Pero in general, yung mga flu vaccines that we've been using for decades, the pneumonia vaccines, that's how they work. And also some of the COVID vaccines that have come out have also worked in the same way. But what it does generally is to induce the body to defend itself against a severe disease. Okay.
Thank you. Thank you po, Doc Sanchez. For the next question po, Yusek Rosette, if ang isang senior citizen daw po nakapag-avail na ng first dose and after 4 months pa sila makapag-decide to get the second dose, can they still avail the vaccine po?
Unang-una, gusto natin ipaalala, no, if without justifiable reason, like medical reasons, sana po wag natin i-delay yung second dose natin for our vaccines. Lumalabas na po ngayon sa mga ebidensya all over the world na ang single dose lang po ng bakuna na maibibigay sa inyo ay hindi po makakaprotekta laban sa COVID-19 Delta variant. Kailangan po natin ng 2 doses so that we can get that adequate protection against the variants of the SARS-CoV-2 virus. Pangalawa po, iba-iba po ang interval ng bawat bakuna na available dito sa ating bansa. Ang pinakamatagal po na interval ng bakuna, type of vaccine dito sa ating country is AstraZeneca, wherein the indication po na nakalagay sa Emergency Use Authority is 8 to 12 weeks. So aabot po ng 3 buwan ang interval na yan. Ngayon, kung nakuha nyo po yung ibang type ng bakuna katulad ng Sinovac, ang indication is 28 days. So hanggang kailan po ba pwede tayo magpabakuna ng ating second dose? Kung tayo po ay merong mga rason na hindi maiiwasan, maaari po nating kunin ng bakuna as soon as pwede na kayong magpabakuna uli. So this can be up to about 3 to 6 months after being vaccinated of your first dose. Hindi nyo po kailangang umulit ng series or yung first dose nyo para kayo ay mabigyan ng second dose ulit. Ngunit ako po ay nakikiusap at amin pong binibigay paalala sa ating mga kababayan, wag po natin pahabain yung time ng interval. Sundin po natin yung scheduled dose of scheduled second dose interval nyo po para kayo ay magkaroon na agad-agad ng proteksyon laban po dito sa sakit na COVID-19.
For Yusek, pa-request na lang po ulit to kindly mute na lang po muna yung ating mga microphones. Para po sa ating next question from Mr. Romel Ancheta, I'll be directing this po to Doc Nina. Even after the first and second dose of the vaccines, it has already been explained by DOH and WHO that we are still vulnerable to the new strain of the virus. While the virus is here to stay, every year the seniors are getting much older and probably will get sicker every day if they or their loved ones are not mindful of their mental or physical needs. Doc, how do we educate our household caregivers so they can effectively apply the needed interventions during this quarantine period?
Thank you for the question. Unang-una po, maswerte po yung ating mga seniors kung meron po silang kasama sa bahay na tumutulong po at nag-aalaga sa kanila. Marami din po tayong seniors na mag-isa lang po na namumuhay, wala po nag-aalaga sa kanila. Yun po ang realidad ng ating buhay ngayon sa 21st century. Dati po, lahat ng matatanda ay may kasama na nag-aaruga sa kanila. So, ano po ang gagawin? Kaya may nag-aaruga ka o hindi, kailangan din pong bantayan ng ating mga barangay officials, lalo po ang barangay health emergency response teams natin, para alam po nila kung sino-sino po yung senior citizen na mag-isa na namumuhay, yung mga may kasama po, at baka pwede din po silang hilingin na gabayan din po ang mga nag-aalaga po doon sa mga senior citizens. Totoo po yan. Habang tumatanda tayo, mas marami tayo siguro nararamdaman sa ating mga katawan. At miski yung physical and mental well-being ay apektado rin po. No? So mapalad po yung mga may kasama, pero paano naman po yung meron ding mag-isa na senior citizen? So ito po ang role ng community, very important, ang barangay po, ang mga kapitbahay, ang mga kamag-anak, ang lahat po tayo ay magsama-sama po para mabigyan po ng karampatang pag-aalaga po at pagpapaalala yung mga nag-aalaga sa ating mga nakakatanda. Thank you po.
Maraming salamat po, Doc Nina, sa pagpapaalala po na talagang kailangan natin magtulungan, no, upang alagaan po at laging i-remind ang ating mga kasama sa bahay, especially yung mga seniors po, to take care of themselves and of course to get vaccinated as soon as possible po. Okay, I think yun na po yung ating mga questions po. Before we officially ends our question and answer portion po of our town hall. And before we close our event po, I'd like to call on Attorney Quijano po for his closing remarks. Attorney Franklin.
Thank you very much, Lindsay. Maraming salamat po sa very valuable lecture na ibinibigay.
Attorney Franklin, I think you're on mute po.
Yeah. Thank you very much, Lindsay. And thank you very much kay Dr. Rosette Vergere, Yusek Vergere, Dr. Nina Carandang, Dr. Shelley De La Vega, Dr. Presi Sanchez, and all others who have shared their thoughts sa town hall meeting na ito. Alam niyo po, I would like to confess that I am a COVID positive. I was a COVID positive November last year. So balik daw, Charles. I'd like to say immunity is the name of the game, as appropriately pointed out by Dr. Priscilla Sanchez. From the lessons I learned when I was a kid, ang bata po ay ipinapanganak as may immunity. At lalo siyang may immunity pagka nagma-mother's milk siya, na breastfeed siya. So we really are saying na the world is not sterile. Medyo marumi po ang ating mundo, lalong-lalo na with the pollutions we have. So it's really good to be conscious about our immunity. And that is why talking about vaccination, yan po yung booster ng ating immunity as we grow old. Kasi nung bata tayo, mataas ang immunity. As we grow old, bumabagsak yung immunity natin, lalo na kung may mga stress, nagkakasakit tayo. Kaya kailangan natin ng mga doktor, kailangan natin si Dr. Presi Sanchez, si Dr. Vergere, para ma-address yung mga sakit natin. But it is our doctors who are saying na para maipataas natin ang ating immunity, kailangan natin ng mas marami pang antibodies, kaya may bakuna po. Kailangan po na may bakuna. So even as I had, alam nyo po kasi nung nagka-COVID ako, siyempre yung antibodies ko ay tumaas. So I thought, baka hindi na ako na kailangan magbakuna kasi nataas ang antibodies ko. But then I realized after lots of discussions with some doctors, ang sabi, kailangan mo ring magpabakuna. And so in May and in June, nagpabakuna po ako. I was fortunate to have the best practice in Cebu. Alam niyo po, in Cebu, the hospitals are helping DOH and WHO. And so I hope that in all LGUs, sana po nakikinig ang mga barangay natin at saka mga mayors, please try to encourage all the health workers, including the doctors. Kailangan na tayong magkaisa para matulungan ng lahat. So when I had my vaccination in Cebu, I realized na, well, hindi naman sabihin kailangan magkumpiyansa at wag nang mag-face mask at face shield, but at least there is some assurance na pag inatake ka uli, the chances of survival are higher. So, you know, the statistics pointed out is very obvious. 90% ng mga senior citizen ang gustong magpabakuna. May mga gustong magpabakuna pa nga na limited yung mobility nila. So I met one in Cebu. I think he is one of the first. 94 years old po siya. Ang gusto niya magpabakuna every day, yung mga anak niya, tinatawagan niya, yung mga anak niya sa US ay nagre-remind sa mga kaibigan nila na baka pwede niyong matulungan si Papa dahil gusto niya magpabakuna. So we had to go to the DOH and the local IATF. And salamat naman, after maybe about 3 weeks of kinakalampag namin yung DOH, local LGU, on July 5 of this year, nabakunahan po si Mr. Carlos Espinosa. Kung kaya pinapakita ko yung picture to show that there are senior citizens even almost reaching 100 na gustong magpabakuna. So the problem that we are facing is really yung mga nakikinig sa chismis at saka yung mga hindi desidido na about 10%. We hope that we can reach out to the 10%, but more importantly, we also hope that we will be able to convince the LGU to improve the best practices. Ang isang problema kasi may mga LGU na yung doctors lang nila ang namobilize ngayon at yung ibang mga doctors ay hindi pa namobilize. We really hope that this is going to be a whole of nation approach and a whole of government approach. So having received all this information, itong mga impormasyon na natanggap natin, kailangan nating kumbinsihin yung nami-mislead dahil sa false news, fake news, conspiracy theory, at saka yung ayaw magpabakuna. Of course, I agree with with Yusek Vergire na walang persahan naman ito. But then again, I hope we all realize that reaching the herd immunity, dapat mauunang protektahan yung senior citizens at saka yung mga with comorbidities. Kasi yung mga younger sets, magkasakit man sila, but hindi na, ang iba sa kanila hindi na nga kailangang magpunta ng hospital because their immune system can address it. But in the case of the senior citizen at saka may comorbidities, kailangan talaga na may bakuna muna. So like I said, 90.6% ang willing to be vaccinated. So dito sa mga senior citizen, we should take advantage of this fact na willing na ang 90%. Ang problema na lang, yung 10%. But, we have to be conscious of time. Gusto nating makamit yung herd immunity. So, kailangan mabilisan. Of course, we understand there are some of us who are impatient nga bakit hindi pa dumarating yung bakuna sa lugar natin. But we also understand ang Metro Manila ay unang bubble na kailangan protektahan. Ang Cebu, Davao, Iloilo at Bacolod, ito yung mga lugar na kailangan mauna yung bakuna. And then of course, we hope that government will soon bring the vaccines to the other areas. Not only the other areas, to the last unit of the barangay. So we need to protect, and we hope that we can also convince yung mga katulong sa bahay, yung katulong sa senior citizen na magpabakuna. Kasi incomplete po ang solusyon pagka ang senior citizen lang ang binabakunahan, tapos yung mga katulong, yung mga caregivers ay hindi nababakunahan. So we hope that our local government units and our barangays will also be conscious na kung maaari yung lahat sa bahay na may senior citizen ay mabakunahan. Then of course, kailangang makipag-coordinate with the LGUs and with all the hospitals, setting up priority lanes para sa mga vaccination para sa senior citizen. Sana po may mobile vaccination units tulad ng ginagawa sa ilang mga cities and municipalities like dito sa Pasig and all. And then of course, we are happy na ang mga LGU at ang mga doctors natin are also responding by going house to house. And then of course, nagpapasalamat ako ngayong umaga na ito dahil even our partners, yung mga senior citizens organization and association like the Senior Citizens Welfare Association of the Philippines, isang social media na grupo all over the country, are exchanging views with us. Also, the FISCAP and the OSCA are with us. We hope that with all uniting, we would be able to address the issue of protecting our elderly and our senior citizen. Because protecting our senior citizen protects our economy. Hindi lang yan. Our senior citizen ay magagaling pa. Nakakatulong pa po para maibalik ang sigla ng ating ekonomiya. At bukod dyan, our senior citizens have the purchasing power. Pagka na fully vaccinated yung senior citizen na umaabot ng 9 to 10 million, siyempre yung pera nila ay nakakalabas dahil pwede na silang lumabas dahil fully vaccinated sila at nakakabili na sila. And then our economy will again grind to a higher level. And so, mga kaibigan, it's really high time. We should go into vaccination. No one is safe until everyone is safe. Pagka nakamit natin yung herd immunity sa ating bansa, yung ibang bansa nga, kailangan pa rin kumbinsihin natin. So, I hope that we will all unite. And if you need to exchange information with us, we can be reached through ph.ncsc@gmail.com. Yan po yung email address namin. At kung gusto nyo sumulat, at ground floor 101D, Mabini Hall, Malacanang. Mga kaibigan, WHO, DOH, Yusek Vergere, and all our resource person, maraming salamat po sa oras na binibigay nyo. Sharing your time is really caring and loving the senior citizens. God bless.
Maraming salamat po, Attorney Quijano. And yung sa mga experts po natin, baka may final message din po tayo sa ating mga barangay health officials, mga barangay health workers, and mga ating LGU officials na present. I'll begin with Dr. Sanchez po.
Hello po again. Thank you lang po again for allowing us to join in educating people para po makita ng lahat kung gaano ka-importante ang pagbabakuna sa senior citizens. Nasabi po earlier ni Dr. De La Vega that this is the decade for healthy aging. So ang ibig sabihin po nito, just to reiterate po yung nasabi ko sa lecture kanina, is that lifestyle measures are very important para po ma-prevent natin yung onset of diseases. Tapos kung meron na pong comorbidities, kailangan pong kontrolado ang mga ito so that we can promote a long, independent life, good quality of life for our senior citizens. And of course, number one na po dito in this time of COVID is vaccinations. Vaccinations are safe. They will protect you from severe illness and from death. So, kailangan nyo pong i-educate yung mga people who are under you, people who listen to you, in order to promote this very, very important message na ito po yung pinaka-purpose po ng roadshow na ito. So, salamat po ulit for your attention to us this morning. Thank you.
Thank you very much po for your time also, Dr. Sanchez. And lastly po, may we hear from Dr. Nina Castillo Carandang.
Okay. Magandang tanghali na po. Maayong udto sa ating tanan. Ingat po tayong lahat, hindi lang po sa pandemya, but ingat lang din po tayo sa mga fake news at balibalita at haka-haka. Kung meron po tayo mga katanungan, hindi po natin sigurado, meron naman po tayong pwedeng pagtanungan o tingnan ng mga sources of news. Katulad po ng DOH, Marami po silang impormasyon na binabahagi po doon. Kung meron po tayong katanungan, itanong po natin. No? Pag-isipan po natin na mabuti at tayo po ay makapagtulungan sa kada isa. Hindi po kaya ng gobyerno mag-isa itong laki ng ating problema dahil sa pandemya. Kailangan po tulong-tulong tayo. Kulang po ang pagbabakuna ngayon po sa mga senior citizens. Kulang din po ang pagbabakuna sa mga taong merong comorbidities. So mababa pa ho ang ating A2, yung seniors, at A3 people with comorbidities. Kailangan pong pahalagahan po natin ang kanilang kalusugan at kaligtasan. Kung sama-sama po tayong lahat ay kaya po natin ito. Hindi lang po responsibilidad ng gobyerno po ito, tayo po lahat. Thank you po.
Lindsay.
Thank you po, Doc Nina. Yes, Attorney Fran.
Yeah, may naiwan pang tanong. Kailangan yata sagutin ni Dr. Presi ito. Yung I had AstraZeneca. I refused the second AstraZeneca. Can I get another vaccine?
Doc, if we could.
Yeah, I think I will defer to maybe Yusek or Dr. Karandang to answer the question.
I think Yusek is not in the call na po as she is. She
Dr. Lazaga from NVOC should be able to respond to that.
Doc Sarah.
Yes, hello. Good afternoon, good noon to everyone. So to answer po yung question, no? So as of we have Department Memorandum 2021-0101. So for those who had severe allergy or anaphylactic reactions to the first dose of a COVID-19 vaccine received, so the vaccinee po may receive another dose of vaccine from a different brand that should have different excipients po, no, or iba po yung ingredients dun sa first vaccine na nakuha, and should have clearance po, no, from an allergologist or allergology specialist, no? And yun po usually ang ating inaabiso sa mga vaccine recipients na nagkaroon po ng allergy sa kanilang first dose po. Thank you po and over.
Thank you very much po, Doc Sarah. And if may mga questions man po na na-miss din yung team, we will just be sending out our responses na rin po. And of course, we'll be providing also yung mga FAQs natin to our barangay and DILG officials po. So again, on behalf of USEC Reset po, I'd like to thank all the participants po natin sa town hall na ito, all our resource persons, our experts, who have been with us since the beginning para po i-guide tayo sa ating overall COVID-19 response and of course hanggang ngayon sa ating vaccination program. I'd also like to thank yung ating mga senior citizen groups na tinulungan po talaga tayo upang mag-convene ng mga participants po dito sa town hall na ito para mas malawakan po yung reach ng ating information dissemination campaign. And lastly, nagpapasalamat po ako sa lahat ng mga barangay health officials na nandito po, mga kagawad, mga SK, may mga nakikita rin po tayo from the different barangays in the entire Visayas region. Thank you po for your time and pati na rin po sa ating mga local government officials. So again po, maraming salamat po and have a nice day, have a happy lunch everyone. Thank you po.